Hello all, and welcome to the webinar, An Introduction to the Children's Benefits Access Guide. My name is Audrey Kraus, and I am the Director of the Children's Benefits Access Project at the Disability Rights Legal Center. The goal of this webinar is to provide you with a brief training that will introduce you to this project and will help you effectively use the comprehensive online resource, the Children's Benefits Access Guide, to access information about health care and related benefits for children with disabilities. First, I would like to introduce you to the Disability Rights Legal Center. The DRLC's mission is to champion the rights of people with disabilities through education, advocacy, and litigation. We carry out our mission through multiple programs. I hope you will visit our website at www.disabilityrightslegalcenter.org to find out more about our programs and how the DRLC may be able to serve as a resource or provide services to you or to people with disabilities with whom you work or have contact. LA Care Health Plan funded the publication of the Children's Benefits Access Guide to benefit residents of LA County. The guide is a comprehensive resource and contains information about health care related benefits and services for children with disabilities. In order to assist parents and professionals as they navigate accessing these benefits, the guide focuses on listing and explaining benefits as well as analyzing agency responsibility to provide them. The guide does not constitute legal advice. To help you use the guide, I will take you through 2 sample searches that will illustrate some of the key features of the guide and show you how you can look up information that you are seeking in this resource. Starting with sample search number 1, we are looking for information about transition services for a child eligible for early start who will be turning 3 in a few months. This refers to a child who is approaching her 3rd birthday and will require transition planning because when she turns 3, she will no longer be eligible for early intervention services. The table of contents on page 2 of the guide is an effective way that you can start looking for many of the topics contained in the guide. After you find the topic you are looking for, you click on its heading and it will take you to it. If you click on a link to a chapter that describes a program such as Introduction to Medi-Cal or Early Start, you click on the chapter heading which will link you to that chapter's table of contents. In this example, if you click onto California's Early Start program, it will take you to the table of contents for the Early Start chapter. Here you will find the table of contents for the Early Start chapter, which is made up of several different topics and questions that a user of the guide might have about it. In this case, we are looking for information about transition services, and the arrow directs you to the question, what transition planning is available to a child who is turning 3 years old? Clicking on that question takes us to the text related to the question that we have chosen. This chapter is in a question and answer format, allowing you to select information responsive to your questions. Within the text, there are links to other chapters and resources so you can continue to build on the information that you are finding. On this page, you see a link to Appendix C, which we will look at in a moment, and there is a link to further information on transition services through online resources. This is Appendix C, which lays out the steps in the transition process in chart form. helping us to multiply different ways that users can access the information in the guide. To continue navigating the guide, we look at a second sample search, this time for OT or PT for a student with disabilities. To start, we return to the guide's table of contents, where we find therapeutic services as a great place to embark on our search. Clicking on therapeutic services, there is a new feature of the guide that shows up called the Benefits Matrix. Unlike the California Early Start chapter, the Therapeutic Services Matrix does not describe a full program in narrative form. Rather, the chart collects information about different programs that may be responsible to provide therapies to eligible children. Looking at the columns in the matrix provides information about therapeutic benefits with a focus on how coverage works if multiple entities are involved in the coverage requirements section. The authority column provides legal references that support the information listed. On page 7 of the guide, titled How to Use the Guide, the reader is directed to a website through which you can access legal authorities directly, and helps to explain the kinds of references that the guide cites to. Looking further down this benefits matrix for therapies, we find in the highlighted area information responsive to our search for OT and PT for students with disabilities. If you are searching for information in the guide and you don't know what chapter to start with or what you're looking for, you can search the PDF. This assumes that you've downloaded the document on your computer by inputting the term that you are interested in the window that says Find, located above your document on the right-hand side. This will prompt a search of the document for your desired term, in this case, occupational therapy. And if you hit Find Next, the guide will take you to the next reference to occupational therapy and the next one. By creating this comprehensive guide and providing it to the community and training providers and consumers in its use, the DRLC has aimed to provide families of children with disabilities and the professionals that work with them with comprehensive information about available benefits and agency responsibility, to improve coordination of services for children with disabilities who are Medi-Cal eligible, and to help children with disabilities access a broader range of health care services. The DRLC is continuing to evaluate the effectiveness of the Children's Benefits Access Guide and its usefulness to professionals and parents as they assist children with disabilities to access benefits and navigate complex systems. Please help us with this evaluation process by participating in our post-implementation survey available on the Disability Rights Legal Center Children's Benefits Access Project page. If you would like more information about this project, please visit our website or contact Annabelle Prudencio directly, 213-736-8195. We welcome your feedback and participation. Please look out for an addendum to the guide, which will be posted on the project page shortly, which will update select portions of the guide, which was current as of February 2011. Thank you so much for your participation in today's webinar.